too. So it's a perfect reversal agent. The other medication there is naloxone, and that's for narcotic reversal. And usually we have screened those patients out. Some patients don't tell you they're taking drugs like that. So
why is there a reversal? In case there's a complication, or just to help them ease off the medication after the procedure?
Good question. If someone's not responding well, or they're becoming too sedated for some reason, then we want to be able to reverse them very quickly.
But that's not to say that patients are given a reversal medication on a routine basis.
Not at all. Okay. Not at all. We don't. I rarely ever have given the reversal agent, and I've done hundreds of these procedures. So I think it's monitoring the patients carefully, selecting the right patients, making sure that they meet the requirements medically for the procedure, and then making sure you don't push the limits and over-sedate patients. It's real critical to keep them in a safe zone.
So you just wanted to show that there is an option in case there is over-medication?
Exactly. There are options for reversing it very quickly, and those are at our disposal at any time.
Okay, good to know. Next slide. Maybe a little hard to read, so explain to us what this means.
I'll get through this really fast. This is the American Society of Anesthesiology's classifications for patients regarding anesthesia. So the first one, ASA 1, is a healthy person, no problems at all, under 65 years of age. The ASA 2, one major health problem, either hypertension, like the fellow that called in, Larry called in about blood pressure, advanced age, or diabetes, one of those issues, okay? The lady that called in, Betty, was this one, an ASA 2, just purely for her age. Right. Those first two we routinely sedate without issue. The third one, those are patients I'm looking a little more closely at, and I'm usually talking to their physician prior to the procedure and making sure the physician has okayed us using this drug for them. And these people have to have actively seen their physician recently before we would treat. The ASA 4s, we don't treat in this setting. That's a person like, I think Tom that called about the 5 heart attacks. That's a complicated patient.
But going back to 3, if someone's on blood thinning medication, that's why you would consult with a cardiologist or a specialist to make sure you feel comfortable.
If we're going to take out teeth, we always do. And we want to make sure their bleeding times are correct before we go in and do any type of oral surgery that would affect their clotting factor. So it's important to keep in touch with the physician in that case.
Now, is this the piece of machinery that we saw on that earlier slide?
Yeah, it was way back in the background. This is the pulse oximeter that we use in my office. It's a very simple machine, but it tells us a ton of information. It gives us the blood pressure. It gives us the pulse ox. It lets us know if they're in a danger zone. We have alarms set on this piece of equipment that will tell us if a patient's their blood isn't oxidated enough. So
how are they hooked up?
It's a blood pressure cuff on the arm and then a little device over the finger. If you've ever been in an operating room, they always stick this thing on your finger before they knock you out with.
So is there another medical expert in that room besides you?
No.
So you are in charge of making sure that this monitor is routinely looked at and monitored.
Exactly. They're always on the monitor when they're in the office having sedation dentistry.
How many other people are in the room with you?
Me and an assistant. Okay. Maybe a secondary assistant as well. Typically, it's just me and one assistant. Okay. With the patient at all times.
And when does this get hooked up? While the person is still alert?
Sure. As soon as they come in the office, they are hooked to the machine, and we monitor them from the moment they've entered the office until we're done with the procedure.
Okay. Our time is flying by. We're going to need to take our quick break here. We have more slides to share with you and another 20 minutes of Healthwise to share. So join the conversation with us either by email or by telephone. You're enjoying Healthwise on WTVI.
Educational grants for this Healthwise broadcast are provided by Carolina Dental Ceramics, providing dental restorations for over 27 years, and by Edwin S. Porter, DDS, a cosmetic and restorative dentistry practice. Dr. Porter's office uses the latest in technology and treatment advances and has been serving the greater Charlotte area for over 16 years.
And by the Mecklenburg County Health Department, and by viewers like you. Thank you. If you would like support group information about tonight's topic or any Healthwise topic, call SupportWorks at 704-331-9500.
With us today on Healthwise is Dr. Ed Porter of Cosmetic and Restorative Dentistry right here in Charlotte. We're exploring what sedation dentistry is all about and calling this episode Sedation Dentistry. Relax and wake up with a new smile. You've brought us some interesting slides, and the next one, I looked at this prior to the show and I thought, what is this? It looks like a chamber. So let's go to the next slide and explain to us exactly what we are looking at.
This is just the sedation op in our office. It's very privatized. We have those glass doors there to kind of separate this from the rest of the office. So you're not hearing all the hustle and bustle in a normal dental office.
I see. So those two glass doors would be just a private room, and it's I take it that it's not only quiet but dark.
Well, yeah, we have the ability to turn down the lights. It has some lighting, accessory lighting in it as well. But the main objective is to privatize the operatory for adult sedation dentistry.
Does the patient also have the option of like maybe listening to music or something?
Sure.
Besides?
They have the ability to have their own iPod they can plug in, and they can listen to their music. Usually we have a calming music that we play instead of usually what we'd like to listen to at home is probably not appropriate when you're trying to relax in a sedation setting. So.
Okay. Good to know. I know I've been to dentist's office and they have ways to make you relax, but this takes it a different step or a step beyond. Now, you're bringing us some before and afters of exactly what can be done for someone who is sedated. And you had made reference earlier in the show that usually people that come in, they have several issues, and it may take longer than what, a regular office visit?
Sure. I think if you're planning on being out of work for a whole day, you're probably going to do more dentistry than you would if you were just coming in for a routine visit. So I think in this instance, you're going to see patients typically catch up on a lot of stuff that they haven't done, either because of fear or because they just haven't found a way to get it done in a comfortable way.
Okay, let's go to the next slide, and this is a before picture. What is wrong with her smile?
Well, she has implants actually right adjacent to her two front teeth.
Now, what are implants?
Implants are a replacement for the root of the tooth, and you can see how that metal implant, you can see it on the right-hand side of the left-hand side of the screen.
Oh, the darkness?
Yeah, the darkness right at the gum line. So that's an implant under the gum that you can still see. But she's never liked the way her teeth look. And this, I don't want to emphasize having your smiles redone. That's not what this is about. This is more about getting a lot of dentistry done because you're out of it the whole time.
I understand. So here she thought, okay, I need to have work done. I'm apprehensive. Perhaps this is the route to go.
Right.
And during the treatment, she had temporary crowns, and that's the next slide.
Right.
Did she realize that these crowns were being put on?
Oh yeah, this was all treatment plan prior to doing any of this. And this patient's actually an actress in Charleston, South Carolina, and she wanted to have a lot of dentistry done at one time. She never liked the way her teeth looked, and this was a way for her to. And she also was fearful of the dentist, so this was a great fit for her.
So when we say during treatment, temporary crowns, this was the end of that day, that session, and then she comes back.
She was sedated for about 5 hours. She came in the way you saw on the first slide, and then she left this way.
I understand. Okay, and then the next slide is what? Maybe weeks later or days later. This is the result.
Yeah, but this needs a little bit of explanation. This was the day the final dentistry was put in. The gums still aren't healed, so this is just a shot we took immediately after insertion of the permanent dentistry.
How would I know the gums aren't healed?
Well, they look kind of puffy.
They do?
Yeah, and what you would see over the course of the next several weeks is her gums would look totally perfect and healthy, but I think the biggest transformation is the fact that she had all of her teeth fixed up top.
So are those crowns, are they veneers?
It's a combination in her case. She has a couple of teeth that are implants, like we said earlier, so there's a couple of implant crowns, there's a couple of veneers, and there's a couple of just regular crowns there, too. So it's a multitude of things.
And then the last slide shows a before and after all together.
Right.
And you can see the difference. Her teeth are whiter, too, with those crowns.
Which is typical with having a lot of dentistry like that done. You want to have a whiter smile when you're done.
Well, if she's on stage, you know, she wants that Hollywood white, right? Is that what you call that?
Well, that's probably not Hollywood white, but it's definitely a lot whiter than her teeth were.
And they look natural, don't they?
Right. That's the main thing, is that they fit her. They look just like her.
Okay. So I'm sure there are people out there wondering if Medicare or an insurance plan would pay for sedation.